All right. Good morning, everyone, and thank you for joining me for this live virtual press conference. We are also streaming this press conference on Facebook at Council Press BMS. I'm here this morning to discuss Baltimore's response to COVID-19. This is a public health emergency unlike anything we've ever seen, with real health and economic impacts. As we've all experienced, this situation is changing rapidly by the day and even by the hour. I will continue to share information from government officials, most importantly from our health professionals and from our business and nonprofit sectors in Baltimore. Today, I am unveiling a document of legislative proposals and opportunity for state and federal partnership for our city titled Supporting Baltimore During and After COVID-19. You can read it now at baltimorecitycouncil.com and by clicking COVID-19. This document lays the groundwork for a successful and equitable recovery for Baltimore. It outlines how I intend to address immediate and long term needs after and during this crisis, but most importantly, ensuring the well being of our people. In an unprecedented global emergency like this one, everything must be on the table to offset impact of this crisis on our residents. This is including considering using our city's rainy day fund to mitigate some of those issues. We also understand that early estimates indicate that unemployment rates may rise to 30%. No, this situation is already creating significant financial hardship for many of our residents. And even in the best of times in Baltimore, we are a city with extensive needs and with thousands of residents who struggle with extensive financial hardship and can barely make do in the first place. As impact begins to be fully felt, it is my duty to ensure our most at risk residents are provided for. Without an adequate response from all levels of government, effects on our people and our economy will linger well past the conclusion of social distancing. So far, during this crisis, I've been focused on meeting the immediate needs of our residents and providing accurate information rooted in the public health experts, while not forgetting that Baltimore also has an ongoing epidemic of gun violence in our city. On February 10th, I called for a hearing on the city's preparedness for coronavirus. We held that hearing on March the 10th, the same day the first cases were confirmed in Maryland. I've been hosting daily live briefings with the public to provide updates and answer any questions that they have. As we know, many of our residents are scared. They don't know where their next meal is going to come from. They want to know how they can apply for this expanded unemployment insurance. They want to know who they can call to get help for their student with their schoolwork. And that's why we have to continuously communicate with our residents. My office also released the Baltimore COVID-19 asset map to centralize information about youth food sites, senior food sites, healthcare clinics for the uninsured, special grocery store hours for seniors, and much more. And a few weeks ago, I hosted a telephone town hall with Dr. Josh Sharfstein, our former healthcare commissioner and current vice dean at Hopkins. We answered more than 170 questions from thousands of Baltimoreans about the virus and how we should be moving forward. But we need to go further. Our residents and our businesses are hurting, and we need greater support. Before giving you an opportunity to ask me questions, I want to preview the plan I'm proposing for Baltimore and our recovery and our response to this global pandemic, which of course is compounded by our existing epidemic of gun violence in this city. First and foremost, we know that unemployment insurance is crucial and must be expanded. No one is immune to the economic fallout associated with COVID-19. I want to thank our wonderful congressional delegation for the great work that they have done, led by our great senators and Senator Van Hollen and Senator Carding, and we know that we're going to have to do more. We need these things and need it to ensure expanded eligibility and increased payments, part of the future stimulus bills. We're also calling on the Baltimore Department of Social Services and Maryland Department of Labor to reduce wait times, simplify the application, and get benefits to people as quickly as possible. We must strongly consider using the rainy day fund and existing resources to help stabilize Baltimore. Our city is projected to lose nearly $170 million in revenue due to this pandemic. The rainy day fund is meant for emergencies like this one and should be used to ease the financial hardships facing our most vulnerable residents. So I am proposing that we use a small fraction of the rainy day fund to help our most vulnerable residents in this way. $3 million to reduce homelessness. The public health of people experience homelessness matters, and we should be using funds to rapidly rehouse our most vulnerable neighbors to reduce their exposure and provide them a space to self quarantine. $10 million to establish a loan fund for businesses to provide loans up to 50,000 for help to help with operations and continue to support employees with payroll and benefits. Baltimore County and Prince George's County are pursuing similar programs as we speak. $8 million for workforce development to address the unprecedented layoffs and help people in hospitality and the service industry access and provide them access training to transition to a sector where work exists, like healthcare. We know that many jobs that were lost during this pandemic are probably not going to come back, and we're going to have to work to make sure that those people who are working and providing a life for their families can do that in a different way. And $4 million for nonprofits and cultural institutions. Many of our arts, culture, and nonprofit institutions could face permanent closure without significant support. And when we're thinking about some of these great smaller nonprofits that are getting their funds from larger organizations who simply can't give out money right now, we need a grant program to make sure that these institutions that our neighborhoods depend on, that our children depend on, make it through this difficult time. We also have existing resources that can be leveraged during this crisis to meet immediate needs. The Neighborhood Impact Investment Fund can be repurposed to directly support workers and businesses in Baltimore's most challenged neighborhoods. And I look forward to working with everyone to figure out a way for that to happen. The Children and Youth Fund should make resources available to provide for the basic needs of our young people in this time, providing meals for our youth, obtaining laptops for digital learning, and supporting organizations that have directly been serving youth during this emergency, which of course many of the great organizations that received the fund have already been doing. We also need to better coordinate and leverage our public health institutions in our response. We need to prioritize increased testing and to do it through a lens of equity. We know that COVID-19 can spread from people who show no symptoms. We know Black and Brown residents are disproportionately at risk in low income areas and also are in neighborhoods where we know health disparities existed long before COVID-19. And if we do not understand that and attack this virus in that manner, we will not be doing justice for the citizens of Baltimore. I will also work to coordinate with the private sector, public safety professionals, hospitals, and nonprofits to increase the supply of personal protective equipment, which is critical for our healthcare workers, our first responders, and allowing them to stay healthy while they go out, risk their lives to serve us, to keep us healthy, to keep us safe, to clean our trash. We have to thank them each and every day. They were heroes already, but they're even more so. That person that is picking up your trash, that person that's cleaning the building that you work in, those police officers, those nurses, those firemen, we have to thank them each and every day because they are putting themselves at risk. Our bus drivers, they are putting themselves at risk so that we can go on and have some semblance of a normal life. And we have to thank them at every turn. There is nothing more important than keeping everyone safe. But now, more than ever, Baltimore needs effective coordination. We have to support our food pantries, our faith communities, and religious congregations also have a role to play, and we have to bring them into the fold. And we also must coordinate with community organizations so that we can most effectively get information to all Baltimoreans. No one should be left behind during this crisis. We know that we must also support our businesses. From the BDC's Business Impact Survey to the Maryland COVID-19 Emergency Relief Fund programs for businesses to the SBA loan programs, we have to make sure our businesses know in all of Baltimore's neighborhoods, no matter where they are, that these resources exist and allow them and push and fight for them to take advantage of them. No one should be left behind. No business, no employer, no employee should be left behind as we're going through this crisis. And as recovery efforts continue, I encourage all of our partners, state, local, and federal, to utilize existing programs which will help speed up recovery time as the mechanisms to distribute funding are already in place. And finally, we must develop a regional and federal strategy. When COVID-19 is spreading across jurisdictions, Baltimore, any jurisdiction cannot act alone. More cooperation is needed at the local, state, and federal levels to save lives. The federal government, as we know, passed a $2.2 trillion stimulus package. I advocated that it be geared toward the people of Baltimore and their needs rather than the preservation of corporate profits at this time of financial hardship for many. Congressional leaders have indicated that additional stimulus packages will be needed. I am in touch with our great congressional delegation consistently, but the next stimulus bill should include support Americans with further cash assistance. We know that $1,200 will not go far with rent payments and bills due for many of our residents. Increasing our student loan support for borrowers by forgiving outstanding interest on federal student loans, continuing payroll and benefits supports for small businesses, and to provide direct assistance and infrastructure spending to state and local governments so that we can make it through this together. Baltimore, let me be very clear. Baltimore is a city that cannot be broken. We have made it through things before. We will make it through this together. Together by heeding to the advice of public health professionals, by understanding that this is a serious crisis, by making sure that we're looking out for our family, our friends, our neighbors, but most importantly, by doing what Baltimore always does in a crisis, by coming together to let everybody know, let the world know that we are Baltimore. We will not be broken. COVID will not break us. Nothing can break the resolve of this wonderful and great city that I've called home for my entire life. But we have to do this together. But most importantly, we can only do this by being safe and adhering to the advice of public health professionals. So I am inviting everyone who reads this document and has feedback to share that with me at councilpresident@baltimorecity.gov. COVID-19 is serious. We know Baltimoreans are dying for this virus. We want less people to die from this virus. This is why we have to stay at home unless absolutely necessary. And as I always say, everything that you do during this crisis must be done with the advice of public health professionals. So thank you. And now we will take some questions.
What I'm going to have everyone do, thank you, Mr. Council President. If you're a member of the press and would like to ask a question, I would just ask that down at the participants tab at the bottom of this press conference, if you can click the raise hand function, that'll just let you know that you have a question you would like to ask, and then we can go to you live. Thank you all again for joining us. I see Talia has a question. Okay, Talia.
Hi, thanks for hosting this, Mr. Council President. Can you address the idea to adapt the use of the youth fund? Would that be possible based on the parameters set out for the fund in the law?
So thank you for that question, Ty. This is something that we're going to clearly have to discuss with the administration and the individuals who are in charge of the fund. We know that legislation was already going to be in the works to talk about how it's going to be pushed out. And again, I think that this is something that we have to consider everything. When you're in a crisis like this, you have to consider everything. And I, of course, am one who always thinking about the initial intentions of the fund and making sure that we're meeting that, but also understanding that in this crisis and understanding what young people are going through in neighborhoods across the city, the things that they need in neighborhoods across the city, and trying to figure out how we can help meet those needs. So I'm looking forward, again, this is about partnership. I'm looking forward to working with the mayor's administration, all of my council colleagues, everyone involved, to make sure that we can figure out what we can do and how we can do it in order to benefit, in this case, the young people of Baltimore City.
Let's go to Melody next.
Melody, you have to unmute yourself.
I did. Can y'all hear me?
Yes, ma'am.
Okay. Good morning. I'm wondering if you can expand a little bit on using the rainy day fund for the small businesses, and just will that be administered by the BDC? If so, will it be transparent? There's been, some question about transparency with that agency in the past.
Yeah. So again, Melanie, these are my suggestions for how we do these things. Of course, all of this is going to require, I cannot just arbitrarily say this is how these things are going to be done. I look forward to working with the mayor's administration, the comptroller, and all our agencies to figure out how we can do these kind of things. And you know that anything that I do is going to be transparent and making sure that everybody has access to them. We don't want this to be a case, as you guys talked about in the media yesterday, where like Bank of America is now being shamed for denying people businesses access to the federal things that were put out. I want to make sure that we are benefiting businesses in Baltimore regardless, but especially those that are hurting, and especially those that we know there are businesses in neighborhoods who just typically don't get access to the assistance that's available to them, and those that are hiring people who live in a city and in our city neighborhoods that are already struggling. But anything that I do, anything that I'm a part of, Melanie, as you know, is always going to be a transparent process that we're putting out the information for everyone so that we can reach everyone, because everybody is hurting throughout this crisis. And unprecedented times calls for unprecedented measures. And that's why we're even considering, I'm suggesting this. These are not things that I came to very lightly. It was a very, very tough decision to even suggest some of these things. But we have to consider that when you're considering where we are right now in Baltimore City, but also across the country and the world.
I see a hand from Jane. Jane, would you like to ask your question?
Can you hear me?
Yes.
Morning, everybody. Brandon, just really quick, what is the amount in the rainy day fund?
So I think the total amount in rainy day right now, Jane, if my memory serves me correct, is about 90 million. I'll have to double check with the budget department, but at last check, I think that was what it was total.
And just a follow up to that, the city last week estimated about a $68 million deficit. There hasn't been a whole lot of detail about how that's going to get covered, but wouldn't it make sense that they try to use the rainy day fund to cover some of that?
Yep, I think that's going to be on the table. What the budget department has said to us is that everything is going to be on the table, and they're going to be coming back to us. I think he may have said this to you guys last week. I'm not sure. I know he said it to us. They're going to be coming back to us once they have better numbers with suggestions on how we get to the closing the gap. We know that we started out with a surplus, so that will be helpful, and we might have to use rainy day. There are other things that are going to have to happen. Everything's going to be on the table, Jane, as we go through and discussing these things. And that's why I said that we want to use a smaller portion of it for the things that I suggested, so that we understanding that we're still going to have to deal with the budget now, and knowing that this crisis is ever changing and ever growing among every aspect. Thank you for that question.
Let's go to Juana Summers from NPR.
Hi there, guys. Can you able to hear me?
Yes.
Hey, thanks for doing this. I'm wondering if you can talk a little bit about why you feel it's so important for Baltimore City's health department and the state to publish coronavirus reports that include racial data and zip codes as in addition to what's already being provided to us.
Well, listen, this is Baltimore City. Baltimore is the birthplace of housing redlining by legislation. And we know the history of the inequities in Baltimore City, and the racial inequity is the most drastic in Baltimore. This is why I passed the equity assessment program in Baltimore, to make equity the law of the land, because we know that in Black neighborhoods in Baltimore, and brown neighborhoods in Baltimore, and poor neighborhoods in Baltimore, in certain zip codes, your health determinants are significantly different than those in others. So where I grew up in Park Heights, it's just right across of 83 from Roland Park, but we know the life expectancy, the amount of people with asthma, the amount of people with exposure to lead paint. So if we're going to attack this public health pandemic, one like we've never seen before, we cannot do that properly without considering what has already happened in Baltimore, what exists in Baltimore, and we've seen in other places around the country already who are putting this data out, how this virus is impacting African Americans at a higher rate, because you have to consider the history of our cities and the history of our country on how the cities in these neighborhoods where Black people live, people are already exposed to these pre-existing conditions from asthma to everything else. We cannot attack this issue without understanding and looking at it through a lens of racial equity. So thank you for that question.
Are there any last questions? We have time for probably one more. Jane, is that another question from you?
Yes, hold on. Can you hear me?
Yes.
Okay. So just to follow up on the last question and the question about the data, when you look at the cases statewide as of this morning, Prince George's County, for the most part, this has been following a track in Maryland of population size. So the counties, the jurisdictions that have the highest population have the highest number of counties or cases. That's changed over the last couple of days, with Prince George's County now with the highest number of cases and also the highest number of deaths, when it's certainly a large jurisdiction, but not as large as Montgomery County. Do you have any, considering exactly what you just talked about with the poorer health outcomes in poorer communities, Black and brown communities, do you think the Baltimore City case count is accurate?
So Jane, I think that we all know, right? You've heard every local official, you've heard basically every governor across the country say that we know that we need more tests so that we can have deeper and accurate numbers. Do I believe that there are people in Baltimore who are asymptomatic with COVID-19 that have absolutely no clue that they have it? Absolutely, because we know the access to testing is not nowhere near where it should be, right? And we understand that we have a president of the United States and his team who dropped the ball, who fumbled the ball on COVID by not taking it seriously and preparing to allow states and local governments to be able to partner with our health institutions to have that. So we know as more people get tested, more people are going to test positive. But again, that's why it's critical for us to have the information in this way, because if we know and we can see that that COVID-19 is impacting our poor neighborhoods, our certain zip codes, impacting African Americans, impacting our Latinx community in a much deeper and disturbing way, then that's what we have to focus our efforts around education, around health, around safety, around how to stop the spread of the virus. This is why this is as important, because when you're talking about neighborhoods where people don't necessarily have access to TV or to radio or to the internet. Remember, Jane, in the beginning of this crisis, I went out into East Baltimore with gloves and everything to literally pass out information, leaving it on people's cars and doors about COVID-19 and how to stop the spread, because I knew that they wouldn't get that information in any other way. When you have to consider all of the other things that go into play with how this virus will spread, you start from the premise that we know that the health disparities exist there. Then you add on the technology gap there. You add on the inability for them to get information. You add on their not trusting institutions and even health institutions in some cases. All of these things that happen and exist there, we know that these areas are ripe for a lot of spread of this virus, which is why this piece of legislation and the work that Delegate Mosby and folks are leading in the state is critically important, because this is a matter of life and death in these neighborhoods that are always more negatively impacted by things like this, because there's so much pre-existing things that date back generations, right? These are generational things that we have yet to address in this country.
Just a quick follow-up to that. Do you also think it would be important to see, which we don't have, is the number of negative tests per jurisdiction zip code?
Absolutely. I think that the way the information they're putting out at state level is great, but breaking it down by jurisdiction, allowing it to be broken down by zip code. Jane, we talked about this yesterday. When we think about how our great health institutions analyze this, they do this, they analyze health disparities. They tell us which zip code has the most asthma, et cetera, et cetera. This should be happening for COVID-19 live throughout this process, so that we can then arm the folks that are trying to deal with this issue with that information, so that we can attack it now. We don't need to study it after it's over and thousands of people have died. We need to attack it now based on that data, based on that info, so that we can make the most impact.
And Talia, we're going to give the last question to you as we wrap up. Talia.
Thanks. Do you have an update on the city's testing capabilities?
So Talia, we know that the mayor and the governor were building up the site at Pimlico, but from what we understand is that we are testing more people here in the city. But again, as the mayor, as the governor has said, we know we need more testing everywhere. We know that right now they're still suggesting that only the most severe cases and people with pre-existing conditions are getting tested. They're doing, let me just also be clear that our folks are doing a great job. We just have to push and go even further. And we're all going to continue to advocate that we have more testing. Nowhere in the United States has the amount of testing that we need. And the leader of this country should be embarrassed that the wealthiest country in the history of the world was not prepared in the way that they should have been, because they simply didn't take this seriously.
Thank you all so much for joining us this morning. We're going to end it here, but we'll talk to you all soon.
Thank you, everybody.